Welcome to the Choosing Happiness podcast with me, your host, Rudrani Devi, the Happiness Lady. In these conversations, we will be discussing an uncommon way to find joy in your life with weekly special guests. Did you know you could choose your happy? Won't you come and play and discover how these magical tools could work for you? Let's do this. Well, howdy, y'all. Rudrani Devi, the Happiness Lady, even wrote a book about it. Choosing Happiness, an uncommon way to find joy in your life. And I am thrilled to have my next podcast guest, Dr. Stephen Kravitz. We have a relationship, a patient-doctor relationship, y'all. And I'm super excited. I am working on a book, full disclosure, and I wanted to interview the folks that helped me get through my crazy falling apart PTSD and symptoms and weird stuff and all that. So I'm super grateful to Dr. Steve for all that he has done for me. And let me give him a proper introduction. Dr. Steve Kravitz has been in practice for over 25 years, y'all, and treats infants, children, and adults with a combined approach of physical therapy and advanced manual therapies drawn from the oh my goddess, it's a big word, osteopathic philosophy? Okay, including therapies such as, and this is one's my favorite, y'all, it's CranioSacral Therapy, Myofascial Release, Visceral Manipulation, and Nerve Mobilization. And what's so cool, I mean, he'll be like, feels like he's doing nothing, like barely moving stuff, and then I'll feel something, a completely different part of my body. It's fascinating, but I'd rather him tell you all about it. Without further ado, thank you so much, Dr. Steve, for joining us today.
Thanks for having me. I'm excited to be here.
Yay! And the crowd goes wild. So, can you tell my listeners a little bit more about what it is you do? Or, because you've rolled in a lot of things there.
Yeah, there's a lot of names some people can't pronounce. And they're basically disciplines that are a combination of different disciplines where I'm using mostly just my hands to kind of look around the body and feel and locate and find either tensions, restrictions, compressions in the actual physical tissue. And you can get a specific down to a pinpoint of working on a little pinpoint of a cranial nerve down to working on an organ system, which is visceral manipulation, and working on the whole spine and the fluids within the body through CranioSacral Therapy. And I do a lot of nerve mobilization, which is either working on cranial nerves or peripheral nerves, which basically run throughout the whole body like spaghetti.
Oh, I did not expect that. Mm-hmm. I do like spaghetti, though. Well, I find it, you said visceral. So is that like what's connected right to is it the tissue that's connected to the skin? Can you explain a little bit?
Visceral means organ.
Basically,
yeah. So visceral manipulation is a whole system of therapy where it was created and developed by Jean-Pierre Barral, a French osteopath. And he was basically in the French Alps and found there was a faith healer in the middle of the Alps that was digging on people's bellies with his hands. And he got one of his patients better, that he was like working on this patient. He got this patient better and had to basically seek out this guy in the middle of the French Alps. And the guy was basically just moving and digging around on people's bellies, probably almost like a Mayan abdominal massage. So this is probably like an ancient form of therapy where people were working on different abdominal organs and visceral organs like the liver or the stomach or the bladder or the kidneys. And you could pretty much put your hand on the body and assess whether or not there's a organ related restriction or tension or tightness, and put your hand on and assess, is this an organ restriction? Is the organ actually is the motility functioning, which is motility is like a breathing in and a breathing out. It's called an inspire and expire, and it moves in a rhythmical cycle. So you could kind of tell a lot about the way one particular organ, let's say the liver, is functioning, whether it's healthy or maybe there's some dis-ease, not disease, dis-ease in the tissue itself. and then you use your hands to influence this really fascial connections and the ligamentous connections to the organ systems to improve the health of the way that organ functions.
That's amazing. And you know that just by putting your hands on someone's body. Tell me about that. You're
Yeah,
reading their body? How?
right. So half of the training that I've done, and a lot of it specifically through the Barral Institute, which is Jean-Pierre Barral's this developer of visceral work and other works too, is you can put your hands on the body, and they call it listening. So you're, instead of with your ears listening, you're listening with your hands.
Huh.
So you put your hands on the physical tissue, and you could feel a pulls or tensional lines that, if you're looking at the body, let's say sometimes I'll start at the feet, and you could feel like a pull to the liver or the right rib cage of the body if that's an area that may need some work. And then you could get more specific and get closer to it. And no matter where you put your hands, if the liver is what needs work, everywhere you put your hands will lead in the body to that spot.
Is it
Called
the
primary
meridian?
lesion. Huh?
Is it the meridian system that you're following, or something else? It's just the body's like the spaghetti. You were talking about the spaghetti.
Yeah, there's lots of spaghetti with nerves, but
Oh,
and the nerves actually innervate the organ system. So the organs would be like a pile of mush that has no function without the central nervous system and the nerve that innervates it and makes it work. Like pretty much the central nervous system makes everything, a muscle, organ, all the arterial systems, everything like kind of in the body needs to go, be driven through the brain and the spinal cord. So so it's like a heart wouldn't pump through the arteries without a nerve that innervates it and tells it to pump.
Huh, interesting. It's amazing how the body knows what to do without us asking it.
Yeah, I know. That's part of the reason why I got into this work. Is it was probably the most mind-blowing thing I could possibly think of working with and studying and kind of dedicating my life to how the human body works, because it's just fascinating, and everything that's working in our body and sometimes not working as well as it could is it's literally like a walking miracle every second of every day.
Yeah. So what actually drove you to explore this further and then make it your career? I mean, 25 years.
Yeah, it's I found it in a way that I basically was always interested in how the body worked, and always interested in nutrition, and always interested in exercise, and but I was stuck in this terrible finance job. I was in Manhattan and working in down on Wall Street in finance, and I was just chained to my desk, and I knew there was something more out there, and I just listened to that inside myself and started exploring and seeking out and trying to figure out, like, is there a way for me to get involved in healthcare? And I literally just simply read, it was a book. It was actually Andrew Weil's A Spontaneous Healing book.
I have read that book. That's crazy.
So
okay, I didn't know this.
This guy, an osteopath named Dr. Fulford. And he was describing all the osteopathic philosophies and how they use their hands to diagnose and treat and influence things in the body. And he had some pretty interesting treatment methods, but that I learned about it. And as soon as I read about it, something just clicked on the inside. I just knew a little light bulb went off and said, I want to learn more about that. And then ever since that day, I kind of just pursued it with reckless abandon.
That's how I am. I'm like a dog with a bone when I get interested in stuff. And y'all know, because you've heard me on other podcasts, it's like crazy balls. Yeah. So interesting. So there wasn't you were always into health, but there wasn't like anything chronic that happened in your world that made you look at it. Do you actually go to someone like you prior to you choosing?
Yeah, one of my mentors was, so I learned about it. And then I went to a conference and saw one of the developers of CranioSacral Therapy, Dr. Upledger. I saw him do a 1 hour session with Barbara Brennan, who does like the aura healing. So it was this osteopathic physician and this, energetic aura seeing and reading healer working together on a table for somebody like, on somebody for a full hour together, and he was doing his thing and she was explaining her thing, and I just left out of there. I was like literally glowing. It was the
Wow.
most mind blowing thing. And then that's how I got more interested in craniosacral therapy. So I started learning as much as I could about that, and then I did 7 years of training and then went to physical therapy school.
Wow. Wow. Yeah. Out of doing finance, y'all. So,
Yeah, they drove me as far away as possible.
yes. So I'm just a word to my listeners. If you're really hating your job, maybe, this could be the little push, this contribution, this conversation that perhaps, you could look into, hey, this is actually exciting me. And what else is possible? What could I actually create if I decided to journey it? Don't leave your day job, but maybe look at other possibilities. Because I had no idea you were a finance guy.
Yeah, I was an older student when I went back to school when I was 20, like 30, around 30.
Oh, now we know how old you are because you've been practicing for 25 years.
Yeah, but I would always encourage people. It's never too late to start, and it's don't just work some job just to pay the bills. It should have meaning, and give yourself a sense of purpose, and get you out of bed way better in the morning.
Right. If you're excited about what you do, it's not a job. That's how I feel.
Yeah,
I feel so lucky.
Every day is a learning experience. I never feel like I know enough, and I always want to learn. Every patient lays on my table, every hour, every day teaches me something.
Oh, I love that. And I love how we commune while I'm on the table and you're telling me, for example, you guys. So for those of you that know, and if you don't, just Google Rudrani Devi in Mumbai, okay? And you'll get the rest of the story. But I have a neck injury that occasionally something irritates it. And I have my shoulder will hurt. I'll get this radiating pain down my arm where I can't feel these two fingers. And for those of you that are not on YouTube, and you should jump over because Dr. Steve, good looking man. But my pinky and my ring finger on my right hand will kind of go numb and I'll have this radiating pain. And this time, and I don't even know what triggers it really and truly. Maybe it's stress, who knows? You could probably speak to that. But my right knee was starting to bother me. I was getting on my treadmill every morning and knocking out about 7,000 steps so I could get my 10,000 steps in, for the rest of the day. And it started to really hurt. And then all this other stuff started happening. So I reconnected with Steve actually last week. I reached out and called. I was like, okay, universe, I really need to get in. I know how booked out Steve gets. What else is possible? I call, the receptionist answers, and I'm like, I need to get in as quickly as I can. I know he books out. What's the earliest? Oh, we just had a cancellation for tomorrow. And I'm like,
it's probably blew the person out of the spot. That's kind of, I think, always how you book with me. You're like, you get the decision, like, I want to come in, and somebody just gets out of the way.
They do. That powerful, y'all.
I think that's how it goes.
Dude, it happens. You're right. It always happens that way, doesn't it? It's like when you have a chronic thing.
Numerous occasions.
Not that I always have chronic pain. I haven't actually seen Steve in probably a year and a half, I'm guessing, ish.
Yeah, you've been doing great, I hear. Yeah,
been feeling great. My body was doing wonderfully. I've been lifting weights. I did a 3-month challenge to eat macros and to do body weightlifting again and get my 10,000 steps in and all this. And namely, I wanted to build muscle and I wanted to have stamina because I've been traveling a lot. And some of y'all know that I have a band and I perform with other people. And I noticed that, we came out of COVID and I'm like, I'm winded. I don't have the energy I used to have. My bicep looking in the other direction instead of being a big old muscle I did now. So I did this 3-month challenge and I'm feeling great. And this is literally like 2 weeks after the challenge, all this stuff started occurring. I'm going, hey, what? That's weird. Because I know that the person I'm training with is giving great placement and all this. So I reach out, I managed to throw this other person out of the way so I could get up in the next day. And Steve works on me, and I'm leaving and I feel terrible. My back hurt. I'm like suffering. I'm like, oh my God. And Steve's like, well, I very rarely take an Advil. I'm like, Steve, what can I do? And he goes, take an Advil, maybe, hot bath or something. I'm like, I'll get in my hot tub. And then sure enough, I did that, slept really well for first time in about 2 weeks because the pain had been getting stronger and stronger for me. And I woke up and I was like 90% painless. And then the next day it was all gone. I'm like, so I got really righteous and started jumping back up into my workout, not walking, but the other stuff. And it kind of came back again. And I had some trigger points done too with Dr. Deering, which is another podcast. We did like trigger points is where you find the muscle that is hurting and you inject lidocaine mixture, magical mixture, whatever. And that helps relax the muscles as well. So it started to come back and I'm like, damn it. Okay. We had already scheduled because I wanted a follow up. And then I managed to get in with Deering right before getting to you. So I had the shots. I come to see you yesterday, y'all. Yesterday. And I'm like suffering. Oh God, it's all back. Now my other side's starting to. And so he does his magic. And I was like, oh, I'm limping out of here. What the? Would you explain it to me? Sometimes it take a minute. So I had me an Advil and a cocktail. I wanted to make sure I slept through the night. And I woke up and I'm pain free. I even worked out this morning.
That's great.
I mean, magic. You are Mr. Magic Man with the magic hands. Oh, yay. Who sings that? He's a magic man. Wait. He's a magic man. Yeah. Anyway, I can't sing your praises enough. But
Thank you.
I would like to know your take on why, pain will be gone for so long and then maybe show up, or what do you know about that? I mean, I'm not blaming my body. I'm like, okay, body, we're going to give you a little bit of a break. So, can you speak to that? Yeah.
It's such a huge question, maybe more so than you realize. But because pain is very misunderstood, and they're learning a lot about it now. There's these two people, I believe, out of Australia, Lorimer and Mosley, created this book called Explaining Pain, and they're basically finding that pain doesn't make a tremendous amount of sense, and like where the pain is in your body and the way that your brain sends an impulse. This is the most basic way to describe it. It gets so complicated I can't even sometimes even understand what they're talking about. But
I'm getting this book, by the way. I'm writing down. I'm taking notes, and I'm going to put it in the show notes later.
Is really it's quite a read, and they've found that the same impulse that your brain sends to an area with pain is the same impulse that it sends to an area without pain. So they don't know that there's no brain impulse that's consistent that makes an area painful. So then they start to say, okay, well, then there's a new biopsychosocial model, it's BPS model, that they're saying that there might be something to the emotions and something to the way that the person relates to their own pain that might be driving the way that they feel in the tissue or in their shoulder, wherever they're having the symptom, more so than it being the shoulder's out or the joint is compressed or the nerve is being pinched or something. So they're learning a lot, but there's still so much that is mysterious about pain. So I would probably be a fool to try to answer that really correctly without knowing all the explaining pain science, which is a whole novel.
That's interesting. So it could be you have a point of view about something, that's stressing you out, and that could cause the pain.
Right. And they want to tell people in the book, they would say, you don't want to own your pain. You don't say, oh, that's my pain, my right shoulder pain. You don't want to own it. You want to acknowledge it. Okay, that's an area that, that there is pain, but it's not my pain. And, they try to help you relate to it in a different way that you could almost, through coaching and through verbal dialogue, help somebody through their pain. So there's a lot of, people finding different mechanisms of helping people in this, to relieve their pain. Dr. Sarno was the one that did a lot of working with the limbic system and the rage response. And
Rage response.
yeah, so people that were like had some kind of anger, pent up frustration in their body would sometimes manifest it as like a low back pain. So
Huh.
we would work on this limbic response and get them to manage and deal with their rage response or their anger, and lo and behold, their back pain would go away.
Wow.
However, I would find sometimes these people that would come into my office and say, "Oh yeah, I read Dr. Sarno's book, my back pain went away." But then you'd feel physical restrictions in the back that they had before they read the book and then after. So there you would see like a rotation in the spine and like maybe a side bend and a rotation in like an L5 vertebrae. And it was still there. So their mind and the way their mind related to it somehow got discharged of that emotion and made them disconnect from that pain response. So that's fascinating.
That's amazing.
Yeah, it's
That's
quite.
amazing. I know in access consciousness, we always, we, it's not that we're disassociating with the body, but we call this the body and then the infinite self, or the body and the being. And, the being is animating the body, I guess, or your soul, or whatever you want to call it. So in access, we always say, yeah, my body is crying, or my
Yeah,
body's in pain. It's like, it's not like I'm crying, I'm in pain. It's like, we don't actually take it on as our pain. We can acknowledge that our body is trying to show us something.
yeah, like a signal that should be paid attention to,
Mm-hmm.
but not like coddled and like owned in like a full ownership of.
Right. Gosh. So it's interesting you said that, because I read The Body Keeps a Score. You aware of that book?
Sure.
I had to stop reading it because it was giving me PTSD. And
Yeah.
I was reading it during the time that I was discovering that my symptoms were related to PTSD that I had stored in my body. So y'all, we're getting ready to talk about me now. Anyway, and how I found this dude, all the stuff. Literally, I was going to a homeopathist that recommended the book. So I bought like 3 books that she recommended, but that was the one calling me, and I started to read it, and I'm like, oh my goddess, y'all. He's talking about how you cope to try to stuff your PTSD if you're not taking medications. Because I wasn't taking depression medication. But here I was, a marathon runner, perfectionist, OCD, ADHD, autism, never diagnosed for it, but I had all the symptoms for that as well. I mean, there were so many things, and I had to stop reading the book because it was freaking me out. I was like, oh my gosh, I've been doing all of this to keep this PTSD from coming to the surface. It's like extreme sports people. A lot of those might be people that were traumatized. How do they have that discipline? Because controlling themselves is really the only control they have in their world. At least I'm going to tell my story. That's how it was for me. I thought, I can control this. I was a bodybuilder, all these, marathon runner, blah, 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 blah. So I had to put the book on the shelf because I was actually starting to read it when all my symptoms were showing up. And I remember, and this is before I went to seek help, that I was talking to a colleague of mine who used to work with, I don't know exactly what her position was, but she worked with a lot of people that had mental health issues or brain injuries and all of that. And I don't know if you guys know me, I have pretty severe brain injury, but I'm, according to Dr. Deering, one of the most highly functioning people with one, if you want to go back to that interview. And he explains it brilliantly. But what had happened was that I had a conversation with one of my colleagues, and then the next morning, I didn't remember it. And I was like, oh my gosh, I have to call her and update her with all these things. This short-term memory loss is part of the PTSD stuff. And I'll be honest, I still got it. Okay. I mean, I'll out myself. I mean, literally ordered some manuals last night, and then this morning forgot that I'd ordered them and went to reorder them until my assistant said, hey, you ordered those last night, girl. What's your problem? I'm like, oh God, whatever. So it still happens if I'm tired and I'm not paying attention. So I call her, and she basically facilitated me through what she calls unwinding, where I sat on the couch and she asked me to ask my body to do whatever it needed to do to let go of whatever it was holding on to keep me from exploding, is how I want to explain it. And so my body just started doing this really weird moving. And then before I knew it, it's jerking around. I'm like, and she goes, just go with it, flow with it, be cool. Your body knows what it's doing. And it was all that stuff that I had been trying to keep locked in my body, that my body is so smart. It knew what it needed to do to unwind it, to heal. Bodies are brilliant, right? And so that's what led me to all of it, because then I went to Gary Douglas, who is the founder of Access Consciousness, and he's like, find a good homeopath. And from there, I found Dr. Deering, who specializes in chiropractic and brain injuries. And from there, I got to you, because I knew there was another component I required. I'm like, does anybody know somebody that's craniosacral? Because I knew that was going to change things for me. And Lori Ann Jones, excuse me, she's an amazing reflexologist.
She is.
A massage therapist. And we both know her. She's thebomb.com, y'all. And booked out like this one. It's hard to get in with her. Just saying.
Do you remember when you first came, that I think that you were probably one of the first people I ever met that got COVID. Do you remember that? You came to me for a cough, and it was in the fall of 2019.
Yep.
I think you'd just been to Italy or somewhere. You're a jet setter. I can't keep.
I'm all over the place, y'all.
But I believe you were had just been in Italy,
Mm-hmm.
and it was months before the pandemic, which is March of 2020. This was September, October 2019.
September.
And you came to me for the first time to say, I have a really bad cough. And you were you said, that you went to the doctor and they did an x-ray of your lungs and it looked like there was glass in your lungs.
Mm-hmm. Ground glass is what they called it. And my lungs were at 80% capacity. My doctor, after I got over it, said you were dying.
your oxygen saturation was supremely low. And you were, all the sessions you were coming, I was trying to do visceral work on your bronchi and your lungs and trying to get you out of this cough. And meanwhile, I'm inches away from your face and you're probably breathing COVID all over the place.
Sure.
I never wound up getting sick, thankfully. But yeah, you had, that's how we met.
That's true. And you guys, I was a long hauler. It was September through February of 2020 before I wasn't coughing anymore. They diagnosed me with COPD. I had the inhaler. I had a machine that I was breathing on 3 times a day. I was seeing this guy once or twice a week, Dr. Deering as well as Marnie Richmond. And I was I had, and they're not covered by insurance, by the way, y'all. But all the doctors, all they wanted to do was put me on a respirator. They couldn't explain it. She asked me if I was vaping. I'm like, hell no, I'm not vaping. What you talking about? I'm all holistic and shit. Why would I do that to my body? But that's what it looked like. And then it took me so long to get over it, which is why we're having this conversation, because I want to write a book about all those experiences and how you can, you may not, I don't know, you might have to win the lottery. I'm just joking. Insurance won't cover the holistic stuff yet. I'm hoping one day that happens. But yeah, that's what was going on. And I'll tell you this, you were digging into my chest. You were talking about manipulating organs. I remember you going and he was grabbing me, digging this, it was this crazy. And there were marks, man. No, I'm just joking. It was red leaf. It was where he pulled, it felt like he was pulling the skin off my bones, y'all. But magically, the next day, I would feel so much better. And I'm like, I don't know what the hell he's doing. But he knows something, and my body is so smart. It's go back to that guy. Well, that hurt a lot. Not really. It was like yesterday walking out of your office limping and going, I hope Celeste doesn't notice I'm limping. But she was still teaching piano. That's my mom, in case y'all didn't know. And moved her in with me during the COVID. And so she's teaching lessons, and I'm talking to my assistant who's in town right now. And I'm like, oh my God, did I make a mistake? She goes, well, let's check in the morning. I said, we're supposed to work out tomorrow morning. I can't even walk. But by the time an hour later, she showed up, I was walking normally. I had my Advil. I had a cocktail. It was all good. And I passed out hard during The Little Mermaid. I did. We decided to watch The Little Mermaid.
I just watched Moana with my daughter the other day. So cute.
I remember bits and
Yeah,
pieces
nothing
because
like a Disney movie.
we don't have a daughter or a young person. We just, we just like Disney. Anyway,
Just like Disney movies.
we do the cartoons and stuff. What did you think when you met me? And I'm like coughing all over. How long? Oh, you were like, oh, she dying.
It was, obviously we didn't know what COVID was at the time, and you must have been, past the stage of where you were contagious and breathing. So you probably had it before and then found me, but we were treating the long COVID symptoms most likely. But I mean, you were fascinating. I mean, on every level because you had the lung stuff, and then you had this the hyperkinetic movement where you would be on the table, we'd be like working on your head, and you'd be like it was your left arm would just like a ballistic movement out of nowhere, and it was I've been doing this a long time, and I hadn't really seen that reaction from such subtle work. And we were doing cranial work, and I was working on your cranial nerves, and we were working on different parts of your brain and your hypothalamic pituitary axis. And we were doing a cranial venous sinus work to try to get your I remember when you first came, your head wasn't circulating from like a venous and cerebral spinal fluid standpoint. So that's kind of what I did with you. I was working in the lungs, but also trying to get the mechanism of your ventricular system and your venous sinus system open in your head. So then so from there you work on the way on more external structures like membranous systems and bony structures. And, you could start to do different types of technique there. But starting with your circulation in your head was, I remember, crucial for when you first came. And I think because you came with other symptoms too.
Right. And you guys, I lost 20 pounds. It was a weird thing. I couldn't breathe. I was having a hard time breathing. So, you got two holes. You got your nose, you got your mouth. And so I was so stopped up in my sinus area that it was so hard for me to eat. And I would choke on salad. So I was doing a lot of liquid stuff. I tried weight on, which, by the way, doesn't work. I mean, I just was doing everything I could to get calories in me. I wasn't working out at all. I couldn't. I had no strength. There were about 3 months where I was walking with a cane. It was hard for me to get to the mailbox. Imagine driving to go see Steve. I mean, I would go and pass out on your table, even though my arm was flopping and my right leg would flop. And it was like I was wired backwards, or at least, I don't know if you noticed that, but that's something that Dr. Deering pointed out to me later. You guys were so kind because you didn't let me know how freaky you thought I was or extreme until after I was on the other side of it.
Definitely times where I was like, how did she get to my office? And more importantly, how is she going to get home?
He never asked me to text him back when I was safely home, though. Just saying. Anyway, I digress. All the things. But yeah, I had Post-it notes everywhere to remind me of what I needed to do. Fortunately, Siri was my assistant. I would, I'd be like, I got to whisper it because then the old, hey, Siri. Oh, no, already answered. Stop it. I'm not really talking to you. What day is it? What's my first appointment? What time is it? But I actually had a sticky note on my bathroom window that reminded me to brush my teeth. It was that bad. And I still managed to get to you. And I remember in the beginning of it when I didn't know what it was and I was going to Pilates 3 times a week, there were several times where I would show up at the wrong time or I had forgotten to book myself so there wasn't a reformer for me. And finally, I was doing privates with this other girl and I showed up a whole hour earlier and the lady just happened to be there because she was going to do some work on her computer. And she's like, I've been really worried about you. You've been repeating yourself a lot and you seem disoriented. And I had to, follow my sword and go, girl, this thing is creating short-term memory loss. It's a wonder I'm actually getting through the day. I was sleeping hours a day because it was so exhausting just to get to my doctor's appointments.
And you were managing a significant amount of pain from what I remember when you were coming initially. You were having a lot of headaches and migraines and a lot of remember left-sided neck pain that was shooting into really left arm, right arm. On any given day, it could be down your leg. You were managing a lot.
I wanted to die. I mean, I wasn't going to kill myself, but it was like, God, please, if I have to live like this for the rest of my life, I cannot do it. I cannot do it. You know?
Now look at you.
Oh,
Yeah, you're kind of miraculously, probably a true test of your will to want to keep going, to keep, getting yourself to your appointments and, doing the work you needed to do to get yourself better. So it's a true testament to how, dedicated you were to your own body and getting better.
I am stubborn. Tell me that I can do something and I will do everything to prove you wrong. And you know what? Here's the thing. I've had a lot of people. I remember when I got shot and I was doing the book tour and people were like, how in the world are you here? How are you happy? How are you the happiness lady? All this stuff. And to me, I was like, I didn't have a choice, y'all. I didn't feel like I had a choice at all. Serious. It was like, my job now is to heal. Got to heal. Things to do. Blah, 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 So, and I had been through it. I mean, I was India, that was amazing. It took me, over 2 years to be able to walk and not even unassisted. And then I ran the Boston Marathon.
Wheelchair?
Huh?
Were you in a wheelchair for a little bit?
I was in a wheelchair off and on for 2 years because they would do work on me. And I mean, I had to have x-rays, like because they were watching the bone growth. My leg was shattered. In India, they thought it was cracked. They thought the bullet had just chipped one of the bones and it had shattered my entire femur. So my doctor told me, I don't even know how you flew home. If you had fallen, your whole leg would have been destroyed and you would have died because the bullet landed next to the femoral artery. So they basically made a
that would kill you. Yeah.
They did a prosthesis instead of a prosthetic, it's prosthesis where they keep clamping it tighter and tighter and tighter around your leg to keep it together until the bone could grow back.
Okay.
And then once it was finally established and all together, because my kneecap had reset wrong, they had to detach the kneecap and then redo it the way it was supposed to be. So I'm back in a wheelchair again. I'm amazed. My body is pretty resilient, y'all.
Yeah, now you're doing Pilates and like intense workouts and it's the gun.
Welcome to the gun show, y'all. Go over to the YouTube because then you get to see this pretty muscle I got now. I can do push-ups now for shizzle. It's happening. All the things. But then this neck thing showed up, and I was like, I've been meaning to reach out to him. I want to do this other book. I started early 2020 and the working title is PTSD and Me. And I thought that going to piss some people off because everybody is freaking out right now. So I put it on the back burner, worked on a different book. And now I'm working on this book again and another book, which I'm not going to tell y'all about. It's a big secret. It'll come out when it comes out. Just saying. So
it's very timely. I feel like our entire world has a little bit of PTSD after COVID. Yeah. And we all had to, in our own way, deal with so much trauma and so much intensity. And I feel like good time to bring out a book about, you have a happiness book and to, kind of venture into the tough topic of PTSD, which is, a serious topic. It's some people suffer greatly.
I'll tell you something, Steve. I was at the castle in Italy that the company I work with owns, and finally decided it was time for me to get into that book because I knew I was going to look at finishing it. And so I bought it on audio because there's a lot of flights to get to Italy, to Milano, which is where I went. Tuscany is where the castle is. It's like an hour drive from Milano. So I listened to it on the planes. I listened to it in the mornings when I was getting ready, and it is some pretty intense stuff. I mean, wow. So I'm really hoping that this book can be a contribution in a way that maybe it isn't so intense, that shows people, because he was basically showing us, how they discovered PTSD, the wrong and right ways of dealing with it. Because the writer, I can't remember his name off the top of my head, but he basically said he was part of the problem in the beginning because he was the one that was saying we need to give them antidepressants to quieten down all that stuff instead of allowing it to unwind in the body. And, they used to do shock treatments, y'all, if they thought she was crazy or, you couldn't deal with your stuff and it was coming up in your world. They would do shock treatments thinking that was going to fix it. And that actually kind of made it worse. And he didn't realize it until because he had the job of interviewing a lot of different patients. And they didn't want to talk about, had they been raped by a family member or, you leave your body when stuff like that happens. And then it's funny how a lot of those men and women both would recreate it in their adult lives. And so I was like, okay, I was abused by my father, not sexually that I can remember, but I don't think he liked women in that way, but, physically. And when I started to have the PTSD symptoms, it was not about being shot in India. It had everything to do with all the abuse as a child and what I recreated in relationships further into my adult life. Because we have a tendency, they say you show the love you only know the love you show, or you only show the love you know, and you recreate it over and over again. And I was finding the energy of those that were familiar, abusive verbally, like my dad and whatever stuff. And God only knows what he must have gone through to create that. I'm not blaming him. After, listening to this book, I kind of get it. I mean, you get programmed into all of it.
Yeah, you don't know sometimes what somebody else's experience and how that, manifested into their life. And then the cycle sometimes will perpetuate.
Well, I'm curious. So when you're working on people, what you do, y'all, you stand in front of Steve and you look at your body. And then you turn sideways and then you turn around. You look at your booty. I mean, he looks at all the, I'm just teasing. And then you turn the other way. So he kind of assesses, and then the hands on stuff and all the things. So when people come to you, they're usually coming to you for pain, correct?
That's generally how people find me. Like half the time, I would say, is they have some kind of ache or pain and they are looking for some relief. And they realize that I'm doing more than just working on the, and physical tissue and pain, with work on a whole host of things. So that's generally how people find me.
Okay. And so then you start to work on them to unwind this pain. Do they ever start to go into the story that, how do you, I know you're not like a psychiatrist or anything. I'm just curious because I know what our relationship is. I'm an open book, and I know I'm weird. Limbs, I was like, gosh, Steve, I hope I don't smack you. And he goes, me too. 'Cause in the beginning, it was all over the place, y'all. I'd be like jumping, or I'd pass out, like that Z's. So typically when someone comes in for pain, do they ever get to that, that connection you were talking about before where they have an emotion like the anger freak that has a lower back pain or whatever it is? Because I remember my dad had a cancer 3 times and was a very angry person, and he died of prostate cancer, and he also gosh, I just forgot what it's called, where you lose your mind or you lose your memory. Of course I forgot what it's called. Dementia. There you go. Dementia. Yeah. He would eat breakfast and then say, "What, are you trying to starve me? Because we just take the plate away. I'm hungry. Why aren't you feeding me?" "Oh, Dad, you just ate. You don't remember eating?" "I didn't just eat." And he's like, "I didn't just eat." And in my head I could hear, "Bitch, feed me some food." It's like, seriously had forgotten. And so when I started having the short-term memory loss, I'm like, oh shit, turned in my dad. But anyway.
Yeah, that's sad when that happens, and it's hard, on family members as well as the person. So it's, you just got to try to help them the best you can. But so when I'm working on the body, your hands are on the physical tissue, and sometimes you'll get drawn into an area that feels different. Like sometimes it feels like a tissue tension, and sometimes it feels like an area where it's like a little bit chaotic. Like it feels like the tissues has got a stirring quality.
Huh.
Um, and that's sometimes an area where you could maybe reasonably say that there's either emotion or a thought process or a story that's connected to this particular area of the body.
Okay.
And so sometimes you'll be on an area and you'll feel the tissue either releasing or unwinding in your hands, and the person can have an emotion. I had somebody yesterday on my table that just started crying when I was working on her jaw. And sometimes you'd think that, like, maybe sometimes it's not necessary for the person to dive deep into the story. I'm not a psychologist. I'm not claiming to be one, but I know enough to how to, like, at least guide somebody through the process, and at least, if they anything kind of if they need some support psychologically, and always try to refer out. But I know enough to try to help them try to at least connect the dots to what it might be, and to try to think, is there a thought that's coming to you, and is there do you feel anything, is there an emotion? And sometimes they'll come out with it, sometimes they have no idea. But really, sometimes what's the most important is if they have no idea what it's about, that they connect to what the actual emotion is. Like if it's a feeling of sadness, they might not need to know, oh, this is when my mother did this to me when I was 5, but that they can connect to what the emotion is, and that's the physical part of their body that might be storing that emotion, and then they can discharge it. And generally, that sometimes makes people feel better, either physically from their pain, or sometimes, a lightness in their emotions, or can really make something function better, like a digestive tract, which sometimes they call it the second brain. And you release, sometimes part of the digestive tract can be really emotional for people. You start to release parts of their colon or their stomach, and their liver sometimes with anger, and anger can come out, or a deep sadness if you release somebody's liver, for instance. And sometimes the liver numbers you could see on a liver panel on a blood report that the liver is functioning better afterwards.
Interesting.
So, and that's not what I would advertise on my website,
right.
It's, I'm not saying I'm going to make your liver numbers better, but it sometimes is an outcome of the treatment, when you're simply just doing a gentle mobilization of a tissue, and maybe there's a discharge of an emotion or an energetics, and then they go back to their doctor. I have plenty of patients come back and say, hey, you know what, my liver numbers were way better, and they don't know why. And then sometimes I'm not claiming that that's because I released your liver, but it's I think it's quite possible.
It's interesting because I love what you said. This person was crying on the table. They didn't actually connect to a story. You were asking, what's coming up for you? Well, whatever. And they don't come up with, and I'm wondering if that is the PTSD, because, for me personally, when I was in the space of being willing to let it unwind, I started having I'm going to put in quotes, night terrors, where I would recall things and be like, oh yeah, that actually did happen, didn't it? Where something traumatic happened in my childhood and I had blocked it out of my memory. It's a survival technique, according, to the body keeps a score. You do that on purpose so you can actually move on in your world. And I'm wondering, and I'm not saying, the answer, I'm just having this conversation with you, is this person actually connected on some level to that memory, even if they can't actually cognitize it, that is needing release,
I think that's true. And with PTSD or other psychological conditions, you could potentially sit in a chair and talk for years about getting through the PTSD and saying, this is, my childhood abuse is, what you're maybe potentially working on, and you could talk about it and try to, get through it. But sometimes simply releasing a part of the tissue can actually be therapeutic, almost as if you're talking about it
Right.
potentially,
Right.
and help somebody discharge it in a different way. So, it's, I think, quite important to do both. If somebody does have a history where there's trauma or abuse, I think dealing with it and having a trained psychologist or therapist is important to deal with any kind of fallout from that may occur, but then also having somebody working on the physical body that might be storing these emotions in the fascia or the
Sure.
tissue.
Sure.
And so if you're working from both angles, I think the outcome could be uh, more therapeutic and possibly quicker.
I love that. I find that a lot with the work that I do. I'm going to get my hands on your head one day. It's going to happen.
Gonna run my bars.
I've asked to run your bars so many times. We're going to have to make it happen, dude. It's this thing where it's
Can you do it through the computer?
no. You got
Like,
you got to come and get on my little massage table over there. Right there. See it? Oh, it's got my assistant's purse on it because right now this is her bedroom. Anyway, that's beside the point. I digressed. It's 32 points on the head. If you guys don't know what access bars is, go to YouTube and get so much free shit stuff about access bars. Access.
we'll bleep that out later.
We have bleep bleep bleep. 32 points on the head. I liken it to meridian points. Okay. And what it is, it's like a delete button for the thoughts, feelings, and emotions that are keeping you stuck in whatever you've made significant, PTSD or otherwise. And it's not that you forget, and in my case, I forgot a lot of it, but it's not that you forget that stuff that is stressing you out. It's that you don't have a charge anymore. It's like the best massage you've ever had with your clothes on because you're so relaxed when you get off the table, And the cool part is the person that's running the bars on you has any of the same points of view that the person that they're facilitating for. It's like you're gifting and receiving a session because it also deletes it for you. I had a guy, I'm not going to say his name, but he played some tracks on some songs that I wrote, my personal stuffs. Bass player, amazing. His father was an amazing drummer, and he went through a shit ton as a child. I had no idea. He came for a session because some stuff was coming up. And because there was so much abuse, this guy, the parents broke up and the mother ended up dating somebody who was like a drug dealer and then wanted to kill him because he had seen something that he shouldn't have seen at like age 6 or 7. Crazy story. But as I'm running his bars, I am doing my best to stay awake because some of the same energy that he's going through relates to my stuff. And so there I was running his bars. I'm like, oh my goddess, I can barely keep my eyes open. I was yawning, and yawning doesn't mean you're going to sleep. Sometimes it means you're actually, dissipating and trying to uncreate whatever it is in your cellular memory, at least with this work. And so, Steve, I'm going to get my hands on your head. It's going to happen.
When you're running the bars, is it because there's a lot of different disciplines like Reiki? Sometimes they're saying you're drawing from universal energy and you're drawing energy through your hands. Is what
it's not like Reiki because I'm not asking for outside help at all. Because I'm not saying there's anything against Reiki. I have several friends that are Reiki masters and all of that. I chose several other modalities before bars. It's interesting because I was doing like tapping and tuning forks and all this, but I found that one bar session was like doing 40 of these other modalities. And that's just for me personally. I'm not saying that's what it's going to be for everyone else in the world. Although I will say when I noticed how much shifted for me, I was like, damn, this is something I need to know more about. It's kind of like with you, dog with a bone. Oh my goddess, I have got to know more about this. And then you made it a career. That's what I did. Not that I left all that other stuff behind, because I literally had a client here recently where I had to do tuning fork therapy on them. And, your body don't forget. I just found that bars was fast, efficient. I didn't have to have the person weeping on the table, but if they did, it didn't matter. They're releasing. I have no point of view about it. I don't know, Steve. I got to get my hands on your head. Just saying.
One day.
Are you okay? Are you
So
game?
that's made me think of an important concept at the work that when you're, like, say, doing the work that I do, you, in order to listen and find, because sometimes I'm literally working on like a little pinpoint, and focused on a cranial nerve. So, okay, how do you find that? So, really, one of the best ways to try to listen and feel in the body is to try to stay in as much of a neutral state as possible.
Right.
So that's the state that you're not like Reiki, like you're giving and you're not receiving, because you don't really know if what that person has is good for you,
Yeah.
or what you have is good for that person. So the more neutral you stay,
I agree.
it's the safest way to work with somebody, but then it's also the way you can get the most precise and listen to the body and find and listen and locate to the exact structure. And then, so you get there, and then when you're in that listening state, that's when you could actually, I think you could do your best healing, is when you're in that neutral listening state. It's almost basically like you're in a meditation, and
Mm-hmm.
if you can stay there, it's basically, people maybe say it's equivalent to grounding, but there's a specific training that I did. This woman, Christine Schenk, she was in Europe, Austria or Germany, and she would teach a technique that she'd teach you how to, like, very, very specifically listen. Like, and if it's, she equated it to like a 90-degree angle, you're either like you're not at 91, and you're not at 89 degrees, you're at 90 degrees. If you're not at 90 degrees, you are not listening properly, and you might be giving or receiving. So if you stay in that place, so part of the training was trying to teach that healthy boundary, and to keep your energy out of somebody else's and theirs out of yours,
Interesting.
and try to stay in that state. So it's like a muscle. You try to build that up. So the more you build that up, the safer you keep everything, and the more precise you could be.
Wow.
And the better you could heal that structure. So it helps facilitate the release of the tissue and the structure you're working on.
This is what I hear, y'all. Bodies is smart. Just saying.
Is smarter than any doctor you'll ever meet.
Hello.
So if you don't respect the body and you don't listen to it and you don't follow it, you'll be like a dog chasing your tail around in a circle, trying to outsmart the body. You're never gonna outsmart the body. So you may as well work with it and follow it and respect everything about that it's showing you, and know that it's never going to lie. It's never going to show you the wrong thing. So it takes all the pressure off of what I do. Like sometimes, I'm like, well, okay, this person has this tangled web of history.
Right.
What do I do? So you really take all the guesswork out. It's actually very comforting for me, because I just put it all behind me. Like, okay, the person just told me all the aches and pains and all the trauma they just had. And then I try to just go blank. I just try to go blank state, go into neutral, close my eyes, and try to, like, really zone into what the body is showing me. And that area is called the primary lesion. So the primary lesion is the number one spot you want to work in the body. There's not the number 2 or 3. It's the primary lesion. It's an osteopathic concept that if you go there first, you're doing the most efficient thing you could do for the person.
Wow.
So then when you clear that enough, sometimes, you could get it fully, sometimes you could get it partially, but it'll be like, this area is the primary lesion, and you could get it to come down enough where something else becomes more primary, and you listen, you follow the body around like a trail guide. So you'll be like, here's the primary lesion here in the liver, so I'll do visceral manipulation. Here's the primary lesion. Okay, that's the right bronchi. Or maybe there's something going on with the right bronchi, so you could do visceral work there. Then it comes up, you could do there's getting pulled into the nerve complex of the right brachial plexus. I'm doing nerve mobilization. That leads up into the head and goes maybe into the trigeminal nerve on the right side. So I'm doing nerve mobilization. And then you could dive deep into the head. You could be maybe working on the hypothalamic pituitary axis, doing craniosacral or some brain work, So you kind of follow the body around like a trail guide while staying neutral and listening to the body. And then you could do that's how you could do the most the highest good for whoever's on my table for an hour. I got an hour with people in their lives. I got to do the best I can.
I know he just spoke a lot of Greek in those last minutes and a half, and that's
Like, did
okay.
I just say something?
Because I was following the energy of it, but I didn't understand a word that came out of his mouth. So if you felt the same way, don't feel bad. No, I followed the energy of it. I get it. You're like in it to win it. You're like following the energy, going to that space. That's kind of like how bars is, if you'll ever get your ass over here, and all the things. And I could talk to you forever. I could. I might have to actually have you on the podcast again because you have a plethora of knowledge here, and I'm fascinated, and I might want more for the book. I don't know. We'll have to figure that out. But if I have two questions for you before we go. So one is, if you were going to leave my listeners with something, like you want to share a message with them, I don't know, something that works for you. It doesn't necessarily have to do with what you do, but if you could share something with them, a takeaway, what could that be?
I mean, since I brought it up here, I think trying to find your neutral place every single day can allow you to listen to not just other people, like can probably allow you to listen to yourself and really feel what's true, from decision making to how you're feeling on any given day or thinking on any given day. So if you can tap into your own self and listen to your own self by finding this very quiet, neutral place, you can really learn a lot about yourself and probably be guided by what maybe you're going to do on any particular day or put in your body from nutritional standpoint on any given day and who you might want to see as a practitioner. And I know you do a lot of asking of your own body, and I think you listen quite well to yourself, and I'd encourage a lot of people to do that for themselves.
Yeah, I hear you saying honor and trust your knowing. Because your body is so freaking smart, y'all, and if it's talking to you, ask questions.
To listen.
Yeah.
Yeah, and you just have to listen and care to listen, and your body it'll pay dividends, and your body will really take good care of you if you listen and give it what it needs and what it's asking for.
Yeah, my body gets really excited because I actually co-create with it. Oh, you're listening to me. Finally. I mean, most of the time. Actually, my body's a boss of me like 80% of the time. I'm going to say now. I'm proud to actually be able to say that because there was a time where it wasn't even, 5%. So thank you for that piece. Okay, the second question. It is called the Choosing Happiness podcast. So how do you get your happy on? Is there something you want to share? Like, you want to like be there for you, something that excites you. I know you got, the wife to children's, you practice. What do you do for you to get your happy on, dude?
Yeah, they definitely bring me happiness. But if I'm looking for happiness and, that I could kind of a flip of a switch, I love music. So I basically, whether I'm like driving or walking or going to see live music or just simply putting it on at home, it always makes me happy.
Who's your favorite?
My favorite band?
I don't know.
The best band on the planet, I think, is a band called Fish.
No way. PHISH? Shut up. I have all their albums. Are they still around though?
Yeah, they're coming in October.
Oh, shut the front door. We got to have a conversation. I'm just saying. Do you sing or have an instrumental kind of bone in your body thing?
Oh, but I can dance.
Well, show us.
I think that's partially how I became sensitive in my body is through music and through dance.
Can you show us a dance move before we go?
No way.
I showed you one. All right. Do you want to sing us a little tune before we?
Oh God, I didn't claim to. I could claim to do like CranioSacral. I didn't claim to.
Well, that's true, but I just asked you how you got you happy on. So.
Well, I like to listen to music. Yeah, I sing in the shower, but I'm probably.
He likes to sing in the shower. Oh yay! All right, then you're off the hook. this
Yeah, I would thank you. I
office
appreciate that.
this time. All right. So you guys, or whatever. Okay. So I'm going to put it in the show notes, but for those that are not on the YouTube, where could the peeps find you?
Well, I have a practice in Green Hills in Nashville, and I have my website is very creatively my name, stevekravitzphysicaltherapy.com, and I think in the show notes you're putting some socials in there.
Yep.
But yeah, pretty simple Google search would help you find where I practice.
He's the only Steve Kravitz there is. Just saying. I mean, that does what he do that I know of, because I actually Googled you before I asked you for your infos, and you're the first one that pops up, so you're doing something right. Yeah. All right, you guys.
Yeah, I try my best every day.
I'm dancing again for those of you not on YouTube. All right, then. I love it so much. Thank you again for being my guest.
Thank you for having me. It was a pleasure, and yeah, I appreciate being here.
Great conversation. Hey, if you guys enjoy this conversation, you know what you could do. You could hit the subscribe button below. And if you know someone else that could actually hear what we're talking about, like this conversation could be a contribution to them, maybe share it. And here's another thing, y'all. I actually read all the comments. So if there's something you'd like for me to look into, or questions about any of these podcasts, guests, all the peeps, I'm there for you. You're searching, I'm here for you. I got your back, okay? So, I don't know. Reach out and touch me, whatever. Well, don't, whatever. All right. So, thank you again, Steve. Thank y'all for joining us.
Thank you for having me. Yeah, I really appreciate it.
Until next time, ciao, ciao for now.
Thank you so much for choosing happiness. If you've enjoyed this podcast, please subscribe, share, and give us a like. And if you want more happy, subscribe to the Choosing Happiness membership, where you can play directly with me, Rudrani Devi, the Happiness Lady. How does it get any better than that?